Good evening, everyone, and welcome to tonight's HRI talk. My name is Hilary Dort, and I'm the Manager of Communications at HRI. Thank you so much for being with us this evening. For those of you joining us for the first time, HRI Talks present new ideas, discoveries, and studies that are helping to transform the mental health and substance use health landscape in Canada and beyond. This evening's presentation is a reflection on what we have learned in the 5 years since cannabis was legalized in Canada. We'll discuss how the change in legal status has affected mental health and substance use health in this country. We are pleased to have 276 registrants with us tonight, including people from across Canada, Uruguay, the US, and Australia. So thank you and welcome, everyone. Please note that closed captioning and live transcription have been enabled for this event. And if you would like to use those features, click the closed caption or CC button on your Zoom display. I'd like to begin this evening by sharing that the offices of HRI are located on the traditional lands of the Anishinaabe, Attawandaron, Haudenosaunee, and Métis peoples, and the treaty lands of the Mississaugas of the Credit. We support the Truth and Reconciliation Commission of Canada's calls to action, and we are continually working to be more inclusive in our research and our everyday practices. We want to do our part to promote reconciliation and healing, and we invite any input you may have on how we can do better going forward. For those who aren't familiar with HRI, we conduct applied research with a goal to improve mental health and substance use services in ways that can benefit more people sooner. We work with leading scientists, clinicians, and people with lived and living experience from across Canada and beyond. As a registered charity, donations do play a vital role in supporting our research and amplifying our impact. We ask that you consider making a donation today. You can go to our website and click the donate button. Thank you. Tonight, we have a moderated conversation with our host and 3 expert panelists. This will take approximately 30 minutes. After that, we'll shift to answering questions from you, our audience. And we'd love to hear from you. So if you do have questions, please use the Q&A button at the bottom of your screen at any time during the presentation. And we'll get to as many questions as possible before we wrap at 8 o'clock. And finally, before we begin, I'd like to extend our deepest gratitude to our corporate sponsor, CIBC, and our supporting sponsors, KPMG and the Otsuka Lundbeck Alliance. HRI Talks would not be possible without the generous support of our sponsors. Our moderator this evening is Dr. Sid Kennedy, Executive Director of HRI. Dr. Kennedy is a professor of psychiatry and holds the Arthur Sommer Rottenberg Chair in Depression and Suicide Studies at the University of Toronto. Welcome, Sid.
Thank you very much, Hilary, and good evening to everybody, our panelists and everybody else out there. Perhaps for our Australian friends, good morning. I'm delighted to be here. It's unbelievable that it's 5 years, I think, since cannabis was legalized. And what I'd like to do before we go any further is introduce our 3 conversationalists. I'd like to start with Dr. James MacKillop. And Dr. MacKillop is a senior scientist and a Tier 1 Canada Research Chair in Translational Addiction Research at the Peter Boris. He's also the Peter Boris Chair in Addiction Research, the director of the Michael Devillaer Center for Medicinal Cannabis Research, and a professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster University. So welcome, James, and we'll start with you in a minute. My second conversationalist is Dr. Alex Caudarella, who is both a family physician and the Chief Executive Officer at the Canadian Centre on Substance Use and Addiction, also known as CCSA. So welcome, Alex. And our third guest is Michael Devillaer. And Michael is a faculty member in the Department of Psychiatry and Behavioral Neuroscience at McMaster University. And he's also the author of an upcoming book called does kill the corporatization of cannabis. So you may well get a chance to have a glimpse of that later. So what I'm going to do is I'm just going to start with a few questions that I'll bounce around, but I'd like the panelists to feel free to amplify or disagree with some of their colleagues. So James, if you don't mind, I'd like to start with you with a fairly general question. In the 5 years, what do you think has been the greatest impact of cannabis legalization in general on mental health and substance use, health and disorders?
Great to be with you tonight, Sid. Thanks for the introduction, and it's wonderful to be with everyone. I think that, you know, it's such a big question. What is the effect of legalization across mental health and substance use? In some ways, maybe we should start with thinking about just how has legalization changed cannabis use? And I wish there was an easy answer of it's skyrocketed up or it's actually radically gone down. But what we know from the now growing body of literature looking at the changes is that cannabis use has been changing in Canada for a long time that predates legalization. In fact, there was a fairly sharp increase in the rates of cannabis use from about the late 90s to across the early 2000s till prior to legalization. So it suggests that in some ways, cannabis use increasing was probably in part a cause of the change in legislation. And although there have also been studies finding further increases, there have been other studies, including some from my lab, that have shown decreases in use. And what's more, we see that different groups are changing in different ways. So for example, in some of my studies, we found the heaviest users have actually shown reductions in use, which was unexpected to us. And we've seen that people who were not using cannabis before legalization were showing increases after legalization and perhaps deciding to sample or return to using cannabis in the newly legalized market. So it's not a black and white answer that there's been a radical change in one direction or the other. Different studies have found different things. And it's clear that different populations are changing in different ways also.
So maybe just a supplemental question. With the changing of where cannabis is obtained, has it had an impact in separating polysubstance use versus single drug use, do you think?
That's a great question. Well, what we know is that cannabis goes hand in hand with lots of other substance use. People who drink are more likely to also use cannabis. People often use alcohol and cannabis together. The reality is for people who use now illicit drugs or still illicit drugs, there are often high rates of cannabis use also. From my understanding of the literature at this point, there haven't been big changes. But what we do know is that the landscape has not been static, and perhaps the proliferation of storefronts plays an important role. And I don't know about other people on the panel or in the audience, but I've certainly noticed many more storefronts in Hamilton over the last year or so. And there's some evidence that some of the biggest changes in effects on one particularly scary form of mental health condition, psychosis, did not happen after legalization per se, but really started to take off after storefronts became increasingly prevalent. So it may very well be that the increased availability from legal storefronts is playing a role in mental health consequences. And so I think that highlights the fact that even legalization is not a black and white event. You know, the passage of time on October 17th, 2018 was not a magic wand being waved. It's been an unfolding process. And that's in some ways had differential effects over time when it comes to mental health.
Thanks, James. I was going to sort of ask Mike, and feel free to pick up on that last comment, Mike, but I'm interested, you're a policy guy, and I'm interested in how you think the objectives from a public health perspective, have they been achieved? Have they not been achieved? What do you think at this stage?
Right. First, thanks to everyone for joining us this evening. I think it's really too early to tell just how successful we were at implementing a public health approach. I think there are some causes for concern, and I'll give just a couple of quick examples. But I first want to lay down some foundation that I think is important, is that if we think about our two really long-term legal drugs, alcohol and tobacco, those two are associated with most of the drug-related harms, most of the drug-related deaths, and most of the drug-related costs to the Canadian economy. And I think also if we look at those two industries, historically, they've been challenged, their pursuit of revenue with public health protection. And historically, our governments have been challenged in assuring that they maintain and achieve that balance. So I think all that raises a really important question, was what are the implications of all that as cannabis makes this historic transition from a demonized illegal street drug a number of years ago to what is now a legal consumer product. And I guess a couple of things that I would just mention quickly is that a good thing is the ads are not as aggressive as we have for alcohol. That's a good thing. But we also have had a lot of cannabis companies engaging in illegal advertising, and some of it is on the web, often called stealth advertising. And then I just echo James' concern about storefronts. I think the storefronts are a very powerful form of advertising that people didn't really anticipate very much. So and the other thing I guess I would mention that I think was perhaps one of the major mistakes that was made was legalizing cannabis edibles as candy. And I'll leave it with that.
Thanks, Mike. So, Alex, you wear several hats. I've known you over years as a clinician, and now you're the CEO of CCSA. And I'm just wondering, from both those perspectives, what do you see in terms of the populations that you deal with, both from the administrative and from the clinical perspective? Has legalization changed the nature of your practice, or has it just how do you think things have changed?
Thank you, and thanks again for having me here as well. So I think one of the things that Mike was mentioning, there's a lot we don't know yet, and we're growing, we're learning, but I think that applies doubly so when we start looking at really specialized and even more marginalized populations. I suspect over the next 5 to 10 years, we're really going to get a better sense of what's happening. The points have been brought up, for example, around storefronts and also advertising, especially on social media, that seems to be pervasive. One of the things that I've seen is that has particularly affected, I'd say, people with pre-existing mental health issues and substance use health issues. So in particular, when I have patients or clients whose psychosis or psychotic symptoms are made worse by cannabis consumption, it's really hard for them to reconcile this with the fact that they see cannabis kind of normalized and advertised for its often health benefits or the way it's portrayed. So I think that it has been challenging for that population often to see, well, how do all these things not apply necessarily to me? And the same thing with people who have substance use health issues. We know most people who use cannabis aren't going to have an addiction or a substance use disorder related to it. But for those who do, the impact of walking by storefronts and the impact of seeing it in this way is going to be something that's significant. And I think that's one of the things that's been a little bit more challenging, is although cannabis is more available, I wouldn't say that cannabis use disorder treatment has become similarly more available. The other part is access hasn't been equal across all populations. So I spent a lot of time working in the north, and in Nunavut for the vast majority of communities, they still very much rely on that black market. So has legalization as it's been implemented provided the same access or transformation across different populations? I'm not so sure, especially again when we're dealing with more marginalized populations. And maybe lastly, I'd just add that we've seen, so some of the data CCSA has seen is the criminal costs, the criminal justice costs of cannabis seem to have started to decrease, which is good. We don't know specifically if that is equal across all groups, or if those that were already over criminalized are represented, but certainly one of the hopeful impacts had been to see less criminal justice involvement, and it seems like maybe that's happening to some degree. Is it being replaced by other kind of criminal justice involvement for those individuals? We're not sure, or other criminalization, we're not sure. So I think it's kind of been a mixed bag, and probably it's going to take a significant amount of time before we really understand.
So just a last question, do you think there's any population that has been particularly either advantaged and benefited from the legalization, or in fact any populations that have actually been disadvantaged by it?
Well, this is really interesting. I mean, and it gets very complicated, very complex. So for some populations, you know, and we've heard from, for example, some First Nations, that is there an economic advantage and an opportunity there? But on the flip side, is there potentially more risk as, again, more storefronts pop up in areas that might have greater interest in this or that? I think we're going to be spending a little bit of time later, hopefully talking about youth and young people, but I think it's really important to remember that one of the big reasons why legalization was brought forward was to hopefully reduce the really high rates of young use. And I don't think we've really seen that. So some of it is sure where there's been impact, positive or negative. And I think some of it too is where there hasn't been the impact that I think was anticipated. We got to take that away too and really wonder, well, what do we need to do to make sure that future steps are having the desired impact?
Yeah, thank you very much. I'm going to switch over to James, and you do some work, James, in the sort of youth and what we might call transitional youth into young adulthood. And of course, these are developing brains that haven't necessarily matured. What do you think the access and the impact of legalization has had on youth in general?
Well, I think that the good news is that of the studies that have been published looking at cannabis use in youth over the transition and following the transition, it doesn't seem like there are dramatic or even in many cases statistically significant increases. And that doesn't mean that there are decreases, which I think was the original goal of the legislation, but that may have been too optimistic. But certainly the legal status and even the proliferation of storefronts doesn't seem to have provoked dramatically greater youth use. But that doesn't change the fact that still the highest rates of youth use are among youth, and the highest rates of cannabis use disorder are among young adults, 18 to 25. And the younger a person starts using cannabis, the higher the risk they will develop cannabis use disorder. And among people who start during adolescence and young adulthood, persistence in using cannabis is well documented to lead to cognitive consequences, greater risk for internalizing psychiatric conditions, psychotic disorders. So there's a lot of harms that come from early onset use. The good news is, at least for the cognitive consequences, many of those do dissipate if a person stops using. But that's not necessarily the case for some of those psychiatric consequences. And so in a lot of ways, one of the best or most robust conclusions we can draw from the literature is the later people use cannabis, the better. Early use is associated with a lot of different negative outcomes. And indeed, at our young adult substance use program at St. Joseph's Healthcare Hamilton, the number one drug that young people are presenting with, needing help with, is cannabis. And I think that really to springboard off a point that Alex made before, along with a much greater appreciation of thinking hard about the harms of cannabis, there has not been a commensurate increase in service access for managing the harms of cannabis. We do not have dedicated treatment resources for cannabis use disorder. And I think that that's a real gap in existing services, because although only a minority of people will experience negative consequences, those people really need care, and it's not a trivial number. So I think that that's especially the case in youth, but it applies to the broader population too.
I was just
And I just want to build
ahead.
quickly, Sid, on what James is saying. I mean, it is certain things, especially like substance-induced psychosis and cannabis-induced psychosis. We're learning a lot that there's a very significant risk that may produce lifelong severe and persistent mental illness, and in much greater percentages than was originally thought. So I just want to again reinforce this idea of keeping cannabis delayed as much as possible, and how much we really ought to be doing. So as we really spend a lot of time, and policy experts spend a lot of time thinking, okay, well, how does, now that there's legalization, how does the legal market capture more of the illicit market? One of the biggest concerns, especially with young people, is many of the techniques that might be used to move people from the illicit market to the legal market could also increase the number of new or young users that are moving into that. So really the hardest question is, well, how do you do one without the other? Because as we've talked about, the biggest risk really is around this early and young initiation.
Do you think that the use of alcohol has been affected in that younger population? Are they using less alcohol, or do we know?
It's a really interesting question, Sid, and there have been studies that do quite complex and sophisticated analyses looking at whether or not alcohol and cannabis are substitutes or complements. That is, do they go well together, or are they just independent? And I think the jury is a little bit out overall, but we've been doing some analysis looking at the macroeconomic indicators, looking at the total sales of alcohol in Canada and the total sales of legal cannabis. And what we find is pretty strong evidence that the two are unrelated to each other. So there's been a burgeoning increase in legal cannabis sales, but alcohol sales have been pretty much flat at a national level and have not shown any dip as a result of the increase in legal cannabis sales. The only blip we detected was at the beginning of the COVID-19 pandemic. And I think that that's been widely documented elsewhere also. So from what we can tell, broadly speaking, these, although they do go hand in hand for some individuals, there doesn't seem to be a really robust causal relationship, at least between the two for most people.
Okay, that's helpful. Thank you. So, Mike, let me ask, if you were actually the policy leader in the legalization, would you do things differently? What lessons have been learned at this stage, do you think, from the policy perspective?
Right. Well, let's think back to the years preceding legalization, say 2015 to 2018. What we heard a lot was that cannabis legalization would give us a strictly regulated, law-abiding industry that would produce safe product of known integrity. And those are really good reasons for doing it, actually. It hasn't worked quite as well as we hoped. And because I work in policy, I spend a lot of time going through government documents. And so I've been through Health Canada's compliance and enforcement inspection reports of legal cannabis producers. And by the end of March 2022, which is the most recent data available, Health Canada had documented over 2,400 regulatory infractions, 2,429 to be exact, again, by licensed cannabis companies, and 932 of those were classified as major or critical. And the infractions include things like the use of illegal pesticides, mold on product, microbial or chemical contamination, mislabeled packaging. Large amounts of cannabis were seized by Health Canada as a result of these problems at the point of production. And then Health Canada also maintains a recalls and safety alerts database, which lists dozens of recalls of cannabis product that was already in retail stores and therefore in people's homes as well. So the promise of a law-abiding cannabis trade has also been a bit disappointing. We've seen repeated illegal advertising by the big producers. They've been involved in some corporate crime. and there are even collusion with illegal producers. And some of the more notable violations included securities fraud, buying and transporting illegal product, purchasing illegal seed, growing and selling illegal product, and attempting to conceal the evidence from Health Canada inspections. And remember, I want to emphasize this is happening at legal companies. And these are the kinds of things we really hope to avoid by legalizing. But it just has not gone as well. Now, to end on a positive note from all that, at least we have a surveillance system in place to detect these things, which is not something we had previous to legalization.
So is it not being used as much as it could be, do you think?
No, which is not being.
The surveillance.
The surveillance is actually very good, I think. Yeah. It's doing a very good job of detecting the problems. Where I think we could have done better is maybe having some meaningful enforcement. The consequences for violations have been pretty soft and forgiving, with a few exceptions.
If I could speak up, I think that I agree with the point about enforcement, but as you alluded to, Mike, you could argue that all of those infractions being caught by the regulator is a good sign. Nobody caught any infractions in the contraband market. You know, when organized crime was producing vast amounts of illegal cannabis, I'm sure they were using any pesticide they could get their hands on, and I'm sure there was mold growing rampantly. So maybe it's not as bad a sign, and maybe that this is a sign that Health Canada is at least policing, metaphorically, the industry to an extent.
I agree. The policing has been pretty good.
Yeah. So step one has been achieved to some extent, but now we need to do more with the actual follow-up and actions. So James, just back to you, and actually open to anybody. I know that you're a significant researcher in this field. What has the impact of legalization been in terms of your research, in whatever perspective you want to take it? The funding available, is there more money invested in research? The impact of what's supported, what's not? Take it away.
Well, so I think that there have been a couple of really positive consequences. Chief of which were, there's a vastly greater appreciation that we need to do more research on cannabis, including both its risks and harms and also possible medical applications. I think that prior to legalization, if you go back, let's say 10 years, when it wasn't on the table at all, it was really considered a small potatoes part of the psychoactive drug research landscape, in part because the risk profile is lower than most illicit drugs at the time. Although the reality is, after alcohol and tobacco, it's the most widely used substance, and that there are real risks and harms. So I think that as a nation, Canada has dedicated a lot more attention in a positive way to understanding cannabis in Canada, the scope of the challenges, possible benefits in some cases. And there have been, in some cases, significant resources dedicated by the federal government to support this. I think it could have been a lot more, especially given the vast amount of revenue that's coming in from the industry and from retail sales. But in any case, that appreciation is a good thing. There is an ongoing challenge, however, in the new regulated environment. It has remained incredibly difficult to do controlled research on potential medical benefits of cannabis in clinical trials. And this has a lot of somewhat esoteric reasons, according to the Health Canada requirements, but there has not been a particularly friendly environment for testing whether or not the products that people use for medical purposes work or not. And so 5 years in, there is still a lot of ambiguity about cannabis for X, Y, and Z, and most people are not able to look to good randomized controlled trials for answers. They're looking to bud tenders and the industry for answers, which to me is a real challenge. And the reality is, I think also there could have been a much more fulsome and aggressive public education and prevention program to really take on some of these areas of ambiguity where not only could there not be benefit, but there could be real harm. So I think that it's a double, there are two sides of the consequences of legalization in terms of research, some positive, some negative. And I think that we certainly have areas to improve on as we go into the second 5 years.
Okay, I know we're tight on time at this point, but I'll give Alex or Mike a chance to respond either to the research question or anything that you have a burning need to say before we open it up to questions from our audience.
Mike, you want to go first?
You go ahead.
So one of the, I mean, now we're 5 years in, and I think as James said, the sky hasn't fallen, and that's a really good thing. So it hasn't had the amazing benefits maybe we'd hoped for all these pieces, but certainly hasn't caused the catastrophe that I think some people had feared. And one of the big things and the big questions being faced right now is, do we change the public health measures that are often in place around here? I'd say our organization, myself, most of my colleagues are of the opinion that the public health measures seem to be doing what they're supposed to do. I think they're actually doing a better job than many of us anticipated of protecting the mental health and substance use health of individuals. I think the pandemic had been in the middle of it. We don't know exactly what all the effects are of what's happening. We're going to need more time. We're going to need more focused research around these pieces. And by most reports, about 60% of the illicit market has been captured by the legal market, which is actually pretty good. So I think most people feel that, in the public health community, feel that it would be right at this time to maintain the measures that were put in place to protect youth, to protect problematic use, and really just further research what's going on, and not maybe to try and weaken some of those things that were originally put in. And I think ultimately, if we really want to look at mental health and substance use health while trying to preserve people's access who want to use a legal product, I think keeping the measures we have in place is the right answer.
Thank you. Last word, Mike.
I'm going to make a prediction, which is that over the next decade, we are going to see unprecedented levels of drug policy reform. And I'm not talking just about cannabis legalization in other countries, although we will see that. We're also going to see it for psychedelics and quite likely other currently illegal drugs. So I think it's really important that we're very candid about the problems that we've had in Canada and where we have fallen down and where we could have done better, so others who are watching us can benefit from that. And I'll close on that. Okay,
I think in terms of time, I won't summarize, but I think we've got a good sense in terms of the youth issues, the cannabis alcohol issues, and potentially the research areas. And what I'm seeing is it could have been a lot worse. We feel that things have gone relatively well in a number of areas, but it'll take 10 years before we can really have a better prediction and review, or not prediction, but a better sense of how things have really gone. Is that a fair conclusion? Okay, so I'm going to send it back over to Hilary at this point. Thank you. Thank you very much to each of you.
Thank you, Sid. So we're going to pull in some of the questions that we've received from our audience. So the first question is from someone who identifies as a mental health therapist. And they ask, to what degree does the government of Canada or the various provincial governments regulate how businesses can market or advertise cannabis use?
I think in 2 words, it's illegal. They aren't allowed to advertise.
Yeah, but to Mike's earlier point, I think one of the problems is, especially on social media and online, it's actually either hard to police or difficult. So there's been a lot of, I think you described it as stealth advertising. That's pretty true. And then on top of that, there's obviously all the advertising that's being done from the medical cannabis side that hasn't really been reeled in the same way as the regulated. So in that way, yes, we have less advertising than we do for alcohol, but there's still probably more than the legislation intended for it.
I would just reiterate the point from earlier, I think made by Mike also, that the storefronts themselves are a form of advertising and communicate a level of commonality that I don't think was anticipated either.
And, you know, I think when I remember about talking to a lot of public health people at the beginning of this, the major concern was that we would have these big billboards everywhere, like we used to have for tobacco and still have for alcohol. And we don't have that. That's good. But when you think about the storefronts, I think that might even be a more powerful form of advertising than a billboard. I never saw a billboard with a door where you could walk in and make a purchase.
Well, and one more comment on that point. We know from a very large literature on alcohol outlet density that the higher the density of alcohol outlets in a given catchment area, the more alcohol morbidity and mortality. Straight up, the more alcohol harms. And so I think that we may have, and we may need to modify our strategy by recognizing that an excess density of cannabis outlets is going to have public health consequences. I can't imagine how it would not, based on what we know about alcohol.
Okay, wonderful. Thank you, everyone. The next question is, what are some of the key learnings with respect to legalization of cannabis and seniors?
I don't know the evidence on that question, but I'll tell you what I think was an interesting story. I was at a meeting of the Ontario provincial government around cannabis legalization, and I was talking to a woman who was there representing a provincial association of retirement homes. And I thought that was interesting. So I asked her what would bring her to a cannabis meeting. And she said that a lot of the retirement homes in the summer months have gardens where the seniors grow their vegetables. And a lot of members are approaching them asking if they can grow cannabis in those gardens. And she was there to try to get some guidance on this. So I think there's interest.
There is enormous interest. The most common invitation I get to speak is from seniors groups, because the highest proportionate rate of increase is among seniors. And so some would make the case that there are good reasons for this, to the extent that what we hear from seniors is that there's an interest in reducing the number of medications they have to take, potentially getting benefit for chronic conditions like pain, for example, without having to rely on opioids, and generally wanting to try a different strategy. But there are some potential risks also, and I think that the reality is we know that cannabis, especially higher potency cannabis, does have motor impairing qualities, and seniors can be at risk, for example, of falls, and may be more susceptible to drug interactions between cannabis and traditional prescription drugs. So it's an area of great interest. I think that unfortunately there's more observational data knowing that the rates are increasing than really definitive data that tell us whether or not that's a good thing or a bad thing. But certainly the appetite is very high among seniors.
This is where really one of the things that needs to adapt further is, I think, a lot of the clinical training and settings. Because we've gotten a little bit better, especially with tobacco, and I'd say with alcohol too, in terms of properly screening our patients and helping them understand how it's affecting their health. But as James has mentioned, often seniors are on a lot of medications. And so not properly taking into account how those different things might be playing together or interfering is going to lead to more problems. So it really does mean, especially in this regulated legal market where we have these increase in seniors, utilizing the legal market, making sure that physicians and nurse practitioners are well trained in the drug-drug interactions, but also how to best counsel people is going to be really critical to avoiding kind of unnecessary and quite avoidable mistakes.
Great, thank you. I'm going to build off that conversation and include a question that someone submitted at registration, They're asking your opinion why there are very few warning messages offered to the public from the government as to the harmful effects of pot.
Well,
Would
we
you
do
take
have,
that?
I mean, I agree. I think James mentioned earlier, it could have been a lot better. And we do have warnings on all the packaging. So that helps. And we are supposedly moving towards plain packaging, which may help as well. It's interesting that Canada is about to adopt having warning messages on each cigarette, not just the package, but on each cigarette will have a health warning. Now, I don't know quite how we do that with cannabis, but there may be ways, and maybe that's one thing we can look at.
Well, I think that there have been a couple of areas that I'm particularly worried about where we could be doing better in terms of public health messaging and education. You know, one of the most troubling trends is that there have been upticks in pediatric poisonings, meaning basically the children are getting hold of cannabis, particularly cannabis in the form of gummies or other candy-like products. They're consuming that product and they're getting very sick. And I think that the other area that's particularly concerning is rates of cannabis use among pregnant women. And indeed, in some cases, an uptick in the number of emergency department admissions for cannabis-related reasons among pregnant women. And I think that in both those areas, we could have, there's no reason to not have a very aggressive public health messaging strategy, because nobody wants children eating high-potency cannabis gummies. Nobody wants misinformation about cannabis to proliferate among pregnant moms. So I think that there are areas where we could do a lot better and be a lot more strident. I do see public health messaging around cannabis use in driving. I see the messages on the containers. I think that we're not completely derelict in terms of the amount of warning, but we could do better, to be sure.
Okay, thank you, James. Did anyone else want to add to that before I pose the next question? Okay, great. So I'll share the next question. It comes from someone who has indicated they're a social worker, and they ask, how do we mitigate problematic use? What could a harm reduction approach look like in the context of problematic use?
I think it's a really good question. And part of it is, again, the first thing we got to do is get more clinicians familiar with what cannabis use disorder looks like. We said most people who use cannabis, however they're going to use it, are not going to have problems with it. But those that do tend to have, can have quite significant ones. So what are the signs of cannabis use disorder? What are the issues? So that your emergency doctor, or maybe somebody you go in when you're seeing, or your family doctor, might be able to help and kind of pick out what might be a problem. I think the other big issue that tends to be problematic is when you really become dependent on cannabis, and when it becomes an issue that you're having trouble controlling, the symptoms you get when you stop using it, those withdrawal symptoms, are things like anxiety and trouble sleeping. And those tend to be also reasons why people might want to use cannabis. So it becomes a little bit more muddied, a little bit harder to better understand. So I think this is part of why having clear messaging, clear opportunities, more kind of places where people can go. So I actually meet a lot of folks that are asking themselves the question, am I having a problem? Am I not? And there aren't a lot of places to turn to really figure out yes or no. And if so, how do I get treated and supported? The second part around harm reduction, I think, is really important. And this is where we have unique opportunities, especially now that people can have a better sense of what they're using, to really try and encourage people away from those high potency THC products, especially younger people around that legal age, because we know that those are the products that are most associated with those problems James was talking about earlier.
I would just echo those thoughts. I'm a registered psychologist, and as a clinician, I'm open to both abstinence and harm reduction outcomes depending on what a patient's interested in. And fundamentally, a harm reduction model for cannabis doesn't look all that different from a harm reduction strategy for alcohol, to the extent that ethyl alcohol in alcohol is the problematic substance, and THC in cannabis is the problematic compound. So what you're really focusing on is how does a person reduce the total amount that they're consuming, the frequency and the quantity, and ideally titrate down the level of that risky ingredient to try to minimize the harms associated with it. And so I think that although there's not a lot of emphasis on harm reduction, it's a very credible and clinically viable strategy. And the reality is many patients in our clinical programs are not interested in a pure abstinence solution. So you can either choose to part ways or identify a solution that's going to work for them and reduce harms and ultimately is beneficial.
I'll just be very quick. I was on a call yesterday with some people from Vancouver, and the discussion was about the higher and higher strength of cannabis that was being found and being used. Is there any attempt to control, or do you think there should be an upper limit? For example, we have certain limits on the strength of alcohol products.
I think that basically the alcohol metaphor holds. The risk scales to the potency of the product, and extremely high potency products are going to put people at high risk of harms via overconsumption or impairment. So I think that there's a reason that, for example, drinkables are capped at 10 milligrams of THC per beverage unit, and similar constraints could be imposed and are a natural public health strategy to say, let's not let extremely high potency products exist in the free market to the extent that they are going to disproportionately confer harm and not be part of what would be probably a low risk recreational pattern of use. We wouldn't recommend grain alcohol as your drink of choice, right? Nor should we recommend shatter or butter as your cannabis concentrate product of choice, because those are ultra high potency products. That to me is pretty sound science and pretty sound public health strategy.
The most common form of cannabis consumption is still smoking it. And with that, of course, you get all the respiratory risks of smoking tobacco. So potentially edibles offered a great harm reduction opportunity. Where that went seriously awry was making it look like candy. And so you get all these accidental poisonings that we talked about earlier. And of course, also the potential problem is that we have these very, very high dosage levels of the potency being very high in them. So it was a potential really good harm reduction approach that unfortunately hasn't gone as well as it could have.
Okay, perfect. So we have another question from our audience. Is there any data describing cannabis use patterns in people with mood and anxiety disorders in the Canadian population?
While you're thinking, I'll tell you an anecdote from a study I was peripherally involved in, where individuals had to come off cannabis, and they were basically people with social anxiety, and then they were going to be treated from the cannabis perspective. The net effect of discontinuing was actually to get a better score on a measure of depression. So when we have actually thought about cannabis as having potential antidepressant benefits, the in fact opposite was what was observed.
Yeah, and we've known for a long time that there's a very robust correlation between levels of depression and anxiety and levels of cannabis use. It's not been clear whether one is giving rise to the other or vice versa, or if they're independent, but more longitudinal studies are suggesting that cannabis is actually exacerbating depression and anxiety and other internalizing disorders rather than proving to be helpful. And as a psychologist, I will say that often in the treatment of internalizing conditions, you're helping people develop new coping strategies to not avoid certain challenging experiences. And cannabis tends to be used as an avoidance strategy clinically, in my experience. So I think that more and more the idea that the next generation of antidepressants or anti-anxiety medications might be cannabinoid medicines is looking less and less promising.
We've had such fantastic questions from the audience. Thank you so much. It's been really tricky to pick which ones to pull forward. Let's see, we've had questions, a question from an HR professional who asked about speaking to the impacts of cannabis legalization specifically in the workplace. Is that something that someone can speak to?
Well, one of the things I can talk about is there's been a big problem around how to deal with substance use in the workplace for a long time. One of the things CCSA had looked into a number of years ago was the fact that the vast majority of companies don't really have substance use policies built into their workplaces. It means that stuff that could have been supported or helped earlier on is often not. And when there are problems, they can get much worse. I think the legalization of cannabis is maybe an opportunity to rethink that. So not just for legal substances, but also illegal or illicit substances. And what it'll allow and what I think it forces is moving away from purely zero tolerance approaches and more towards better understanding of how specific amounts, but also specific usage patterns might be impairing different individuals who work different kinds of jobs. Might be very different for one compared to somebody else who works a safety sensitive job. It's the way we approach it for most medications and a lot of things that are taken. And I think it's a real opportunity to destigmatize for people who use drugs in the workplace. I think a lot of what we're learning, especially in the workplace around drug impaired driving, is going to be really, really helpful and useful. And there's been a lot more tests and more reliable tests that seem to be indicating and helping both biochemical and otherwise to help people understand the level of intoxication that somebody might be experiencing in that moment. So hopefully what we're going to start seeing more and more of is better thought out policies that really try and prevent inappropriate intoxication at the workplace, that help people early on if they're struggling with substance use issues, but don't necessarily stigmatize them simply because, or fire them simply because they're somebody who's chosen to use cannabis.
Well, I think at this time we're close. Thank you very much, Hilary. I'll just speak briefly and then I think you can close things. I think this has been a really good discussion. I think we've touched on a lot of really key issues, both from the policy, from the clinical, from the different populations, from age. I think we didn't actually touch much on women versus men and whether there were differences in that area. But I think we've touched on the really key issues of high strength product being much more harmful, as is intuitive in terms of comparison to alcohol. We've talked about the fact that there is monitoring, but there's not perhaps enough enforcement for infractions. I'm also struck by when the whole bidding and claims to get a storefront cannabis store, there was tremendous competition and it was very difficult. And then within a few years, it was actually 3 or 4 stores right beside each other. And you wonder how that transition happened, and that maybe that could be a last word from Mike if he wanted to comment. But I think also we touched on the research focus. There is more funding going into research. There are certain questions that are being looked at, but there's a lot more that could be done. Again, I think across age range, the vulnerabilities. It's one of these difficult questions in the mental health and substance use area where we don't know when somebody who's 23 and was at university and they smoked a few joints and the next thing they became psychotic. Was that actually bringing out a latent psychosis that would have emerged, or was there something in the nature of the experience with cannabis that triggered a psychosis that might not have existed? And I don't think we have a really clear-cut answer to that area, but certainly there's an opportunity to do more research, I think, in that area. So what I will do is I will thank James, Alex, and Mike for, first of all, for your time this evening, for your expertise, and I think for your very interesting responses to issues that I think are of interest to our audience and to many of our other people who are in this field. So thank you all very much, and I'll hand it over to Hilary.
Thanks, Sid. So we'll be posting a recording of this HRI talk on YouTube in the coming days, and we invite you to share it with others. If you haven't already done so, you can subscribe to our HRI Talks mailing list, as well as our quarterly newsletter, or you can follow us on social media to learn more about our next HRI talk. You'll see that we've posted a link to a brief survey in the chat where you can offer your feedback on today's session. The survey will also launch as soon as this webinar closes, so thank you very much. Once again, I'd like to thank our corporate sponsors, CIBC, and our supporting sponsors, Otsuka Lundbeck Alliance. We're so grateful to our sponsors and to all our supporters across Canada and beyond. Thanks again for being a part of this evening's event, everyone, and we'll see you next time. Have a great night.